The scope of research at Park is fairly broad, both towards more basic science kinds of questions, in thinking about answering questions that will at some point tell us about treatment on the biological side, but also on the other end, thinking about how do we take treatments that we have developed at Park over the years and extend the application of those, particularly into the community, and in terms of teaching providers in the community how to do these kinds of treatments and increase our reach. One line of research that we're doing at the moment is really integrating kind of questions about treatment and psychopathology that we've asked for a long time into these more kinds of basic science questions, and specifically questions about neurobiobehavioral kinds of mechanisms. What makes things work? What are the circuits in the brain that are implicated in OCD and Tourette's, and how can we access them to help make treatment more effective in an ideal world? So some of the questions that we're most interested in at the moment are looking at the circuits in the brain that might be implicated in tic suppression, for example, and even more exciting, starting to look at what circuits in the brain might be implicated in OCD, and actually in terms of what circuits might help people resist doing rituals. So one of the exciting interventions that we're wading into now is using non-invasive kinds of brain stimulation, transcranial magnetic stimulation, or TMS, to think about, are there ways we could actually augment or make our existing cognitive behavioral treatments more effective, make them work better for our most impaired kids, such as the kids in our intensive program. And that's one of the most exciting lines of work, I think, in terms of integrating research with our clinical program at Bradley. That integration of Park and our research world with the intensive program at Bradley, I think, allows us to do a couple of things. It allows us to, I think, be more thoughtful about the use of evidence-based treatment. So even outside of the context of a research study, everything we do is driven by years of work looking at evidence-based treatment for kids with OCD. It secondly allows us to look at outcome and to think about outcome. How do we track outcome? How do we make sure we're looking at measures of symptoms to see whether kids are progressing in our programs and make sure that we're really giving them everything that they need to get better? And then last, I think it's to think about what are novel treatments we can add, particularly for kids who are what we call partial responders. So a lot of the kids that end up in the intensive program have failed other kinds of treatments. They've failed outpatient treatment, they've failed other more significant interventions, and they're very ill. And so how do we add a research protocol or a piece of a research study to actually think about these most severe kids or the most severely ill kids? That's where kind of the biggest excitement, I think, about integrating research lies.